I'm Dr. Lydia here at Vibrant Life Direct Care to talk to you today about hair restoration. We've been doing hair restoration with Platelet Rich Plasma here for about 2 years, and I want to explain the procedure and what you can expect. So there's different types of hair loss. We deal with a lot of androgenic hair loss in men and women, but Platelet Rich Plasma has applications for everything except for completely scarring alopecia. It can be applied to alopecia areata, where there's a just complete area of baldness in the head, or it can be applied to, like I said, androgenic hair loss, which we deal with a lot here at our office. So what is platelet rich plasma? So plasma is the liquid portion of your blood. So if you're familiar with getting your blood drawn for regular labs, the first step is to draw the blood, but then we put it in a centrifuge and we divide the blood into the red blood cell portion and the liquid portion of the blood. This portion of the blood is responsible for carrying growth factors and other regenerative properties, and then there's a layer here in between that contains white blood cells and platelets. We take this top layer off with platelet rich plasma and we spin it down in our FDA approved machine here to get the plasma concentrate. We actually pull off the top portion of this, and the bottom portion is the rich plasma, which we reconstitute the cells at the bottom, and that's what we inject into your scalp. So I bet you're wondering if this hurts or not. We have a new no burn protocol, which pretty much eliminates most pain, but the procedure that I go through to make sure that it's as comfortable as possible is to initially apply a topical numbing cream and allow that to set for probably about 30 minutes. Then we come back and we apply a block of lidocaine around the edge of the scalp here, which will numb all the way to the crown. And then when we come back with the plasma, we go at the patient's pace and use ice if we need it, which no burn eliminates most of that, but we inject usually the center portion of the scalp, both parts, and then also the crown and any other place that we need to touch up. So that's the procedure in a nutshell. We try to repeat this ideally at 4 to 6 week intervals for a total of 3 sessions. That's because the hair is constantly growing and turning over new follicles. So we want to catch new follicles as they're being developed, and we also want to perpetuate the ones that exist. So the results are usually after the first session, people will come back and we always take before and after photographs. Normally within 4 weeks, we already see an increased number of viable growing follicles. And what's unique about platelet rich plasma is that the hair often grows back at its natural color, even if you've gone gray or white. So women see maximum benefit typically at 6 months. Men will start seeing benefit at about 90 days. We often have patients come and just do touch-ups about once or twice a year just to keep the hair follicles growing, alive. And so if you're interested in this procedure, which is relatively not invasive, very low pain, and very quick results, give us a call here at Vibrant Life and we'll get you on the schedule. Thanks.